for being with us.
Yep.
Yep, I know. Anyway, I really want to welcome you. Many of you on the call, or if you're live streaming, know already a bit about Better Medicare Alliance. We are the leading coalition that advocates for Medicare Advantage. We're based in Washington, D.C. We're a coalition of 121 organizations, some of them based right here in Washington, some of them, to say, from all over the country. And they include national organizations, they include providers and plans, and national associations like American Nurses Association and osteopaths, as well as community partners you probably know, people like Meals on Wheels and the YMCA. We also have over 400,000 beneficiaries. Some of you are in that 400,000 who represent a wide variety of people on Medicare Advantage, and you share with us really pretty exciting and important experiences that you have with Medicare Advantage. So I'm very pleased today that we will be joined by some of my team here at BMA. You met Audra Adolfo, but also some of our ally organizations. We have the National Association of Area Agencies on Aging, the AAAs, as you may know them, in your community. We also have someone from the National Association of Health Underwriters who will be joining this conversation as well, which is just great. So really, oh, sorry, can you hear me? That's not good. I was just told you couldn't hear me. Anyway, we do work on your behalf to advocate for Medicare Advantage to be all it could be, and for Medicare in general to meet the needs of beneficiaries today and tomorrow. So on the call, I know we're going to be talking about open enrollment today and answering some of your questions. So just remember to visit our MedicareMyWay.com website. You can watch live stream today's call, and that you can share this information with friends and family. We're going to post some of this information on our website. It's running back behind me if you can see it, MedicareMyWay.com, and we welcome and look forward to your questions and your comments. So let me pass it along to back to Audra, who's going to open it up with a discussion about this open enrollment guide that we've updated this year with some of the changes that have happened, and I'll talk a little bit more later.
Okay, thank you so much, Congresswoman. If you recognize her, Congresswoman Alison Schwartz, you served a decade in Congress representing Pennsylvania, and now, obviously had a passion for Medicare while a member of Congress, and is now President and CEO of BMA. We're so lucky to have her. Just a few housekeeping notes. If at any point you are disconnected or want to join the live stream, the dial-in information is 877-229-8493, and the code is 116344. So this is if you're live streaming right now and would like to call in and be able to ask a question and listen in. If you have any questions, you press *3. So those who are already on the call, please remember to dial *3 if you have questions. So now we're just going to get into it. The Medicare Open Enrollment period starts on Monday. The annual enrollment period typically runs each year from October 15th through December 7th, except for the initial sign up for when you turn 65. Your coverage will begin January 1st of the following year, as long as the plan receives your enrollment request by December 7th. You have the opportunity to change your plan annually during open enrollment, which is from, again, October 15th through December 7th. And don't worry if you're worried about writing notes. We will send this information after this town hall meeting. So what can you do during the open enrollment period? You can change from traditional Medicare to a Medicare Advantage plan. You can change from a Medicare Advantage plan to a traditional Medicare. You can switch from one Medicare Advantage plan to another Medicare Advantage plan. You can switch from a Medicare Advantage plan that does not offer drug coverage to a Medicare Advantage plan that offers drug coverage. Another one. Switch from a Medicare Advantage plan that offers drug coverage to a Medicare Advantage plan that does not offer drug coverage. And starting in 2019, CMS has decided that there will be a new Medicare Advantage open enrollment period in addition to the regular annual open enrollment period, which will run from January 1st through March 31st every year. So that means that if you're currently enrolled in Medicare Advantage plan, you will have a one-time opportunity to switch to a different Medicare Advantage plan, drop your Medicare Advantage plan and return to original Medicare, sign up for a standalone Medicare Part D plan if you decide to return to traditional Medicare, or you can drop your standalone Medicare Part D plan if you are not in a Medicare Advantage plan that already offers drug coverage. As you know, most Medicare Advantage plans do include prescription drug coverage, and usually you cannot enroll in a standalone Medicare Part D plan if you already have a Medicare Advantage plan that has drug coverage. So, at this point, I would like to invite you all to participate in our poll questions. And we'll invite you to participate by pressing the following numbers in accordance to your choices. So the first poll question is, was the option of Medicare Advantage made clear to you when you were enrolling in Medicare for the first time? Press 1 for yes, I received materials or counseling on my enrollment options, including Medicare Advantage. Press 2, no, I was not told about Medicare Advantage, nor did I receive any materials about Medicare Advantage. Press 3 for I was automatically enrolled in a Medicare Advantage plan. Again, the question is, was the option of Medicare Advantage made clear to you when enrolling? Press 1 for yes, I received materials or counseling on my enrollment options, including Medicare Advantage. Press 2, no, I was not told about Medicare Advantage, nor did I receive any materials about Medicare Advantage. Press 3 for I was automatically enrolled in a Medicare Advantage plan. Again, once the poll question period is over, and in a later date, we'll take questions at the end of this town hall. So around 3:45, we will start to take questions. And coming up soon, we will have a representative from the National Area Agencies of Aging, who will talk to you a little bit about the SHIP program and how to get help from SHIP counselors, as well as a representative from the National Association of Health Underwriters, who will share information about how to engage with a health agent. And we'll continue to do some education on Medicare Advantage and the differences between Medicare Advantage and traditional Medicare. And for that, I invite Congresswoman Schwartz to enter this conversation to share that information.
All right, good. I'll try and do this. So we're doing a little switching back and forth here. So we've gotten very friendly. It's good. Okay, well, just to explain a little more, and some of you will know this, of course, but we did want to just go through really briefly Medicare Advantage and traditional Medicare, and then some of the changes that have taken place. But under Medicare Advantage, your health coverage is provided through a Medicare-approved organization, a private insurance company. Under traditional Medicare, it's provided directly through the federal government. Unlike traditional Medicare, for which you pay a separate monthly premium for Part A, which is hospital, Part B, which is doctors and outpatient services, and Part D, which is prescription drugs. Medicare Advantage bundles all three, Part A, B, and if selected, if you choose it, Part D, all in one monthly premium, often at a lower cost to you. Think of Medicare Advantage as an all-in-one alternative to original Medicare. Medicare Advantage plans are typically integrated plans with provider networks, often referred to as managed care organizations. Most Medicare Advantage plans also cover additional benefits such as dental, hearing, vision, and wellness programs. Some provide transportation to medical appointments, all at no additional cost. And for many people, Medicare Advantage plans have lower out-of-pocket costs than original Medicare. Also, there's some new flexibilities that we see as a very valuable improvement to Medicare Advantage that are just beginning in 2019. So some plans will be offering these different benefits. The new supplemental benefits available to beneficiaries, and the beneficiaries, of course, and the supplemental benefits include, and I'll read the list, but they are intended specifically to address physical impairments, health conditions, and avoidable emergency room visits. So in some ways, they're geared to certain populations of beneficiaries. The new benefits under Medicare Advantage are adult daycare services, home-based palliative care, in-home support services, support for caregivers of enrollees, medically approved non-opioid pain treatment, standalone memory fitness benefit, home and bathroom safety devices, transportation, and over-the-counter benefits. So these are new. They're not going to be available in all plans, but there will be some. And I hope we will see more in the future. But for 2019, you'll begin to see some plans rolling out these kind of benefits to their enrollees. So some people ask us, why get involved in Better Medicare Alliance? Why does Medicare Advantage need any help? Are there any problems or issues with it? So let me briefly explain. New policies that are proposed by lawmakers or regulators may positively impact Medicare Advantage, just as I described in the new flexibilities. That did just happen this past year, and BMA worked on and advocated for those changes. And sometimes policymakers, lawmakers, and regulators will propose new policies or vote on new policies that might negatively impact Medicare Advantage, which can lead to increases in premiums or decrease in supplemental benefits for Medicare Advantage beneficiaries. So BMA, Better Medicare Alliance, monitors and comments on policy options and proposals by CMS, which is the federal agency that deals with Medicare, and Congress. And we look at everything that impacts Medicare Advantage. Changes may be proposed at various times of the year, but by law, the federal government is required to set new rates for the next year and offer new policies on Medicare Advantage every winter. So Better Medicare Alliance pays particular attention to what we call this national regulation period, which is proposed in early February and is finalized in early April. It's known as a rate notice period, and we'll communicate with you about the proposed changes to Medicare Advantage and what we feel about that. So Better Medicare Alliance also submits feedback and written comment, including patient stories from older adults such as yourself on numerous issues that impact Medicare Advantage. So we look for your stories, we look for your feelings about these particular issues, and then we share them with regulators as well. And I have to say, it really is important. They want to hear from constituents, they want to hear from beneficiaries, they want to know how it's going to impact you. So we work closely with our 400,000 beneficiaries, our advocates, and we encourage them to send letters, we sometimes help with this, to members of Congress or to CMS. They sign petitions that we have on our website. We also ask sometimes to take other actions that would help make some suggested changes or in fact support the changes that are being proposed. So our advocates, you, are a critical part of our success because you offer a unique perspective as beneficiaries in Medicare Advantage that we can then pass along to CMS and to members of Congress. We look forward to your questions.
Thank you so much, Congresswoman. Okay, so at this moment, we're going to take a quick pause before we get to our guest speakers. And we want to just give you the results of our last poll question, as well as give you a new question. So on our last poll question, 67% of you said that you did receive information about Medicare Advantage when you initially enrolled in Medicare, and so that means nearly 30% of you did not. So we hope that we can help improve that. The next poll question is, what is your most important consideration when choosing Medicare Advantage? Press 1 for lower premiums, press 2 for provider networks, press 3 for enhanced benefits, or press 4 for choice of plans. Again, the question is, for you, what is your most important consideration in choosing Medicare Advantage? Press 1 for lower premiums, press 2 for provider networks, press 3 for enhanced benefits, or press 4 for choice of plans. Okay. And while you are doing that, I would like to introduce Patrice Ernest from the National Area Agencies of Aging, who's going to talk to you a little bit about what N4A does and the Elder Care Locator and National Call Center. Patrice?
Thank you. Hello, everyone. My name is Patrice Ernest, and I serve as the Director of the Elder Care Locator based in Washington, D.C. The Elder Care Locator is a service of the U.S. Administration on Aging, which is a part of the Administration for Community Living. It is administered by my organization, the National Association of Area Agencies on Aging, a nonprofit organization where we represent over 623 area agencies on aging throughout the country and over 250 Older Americans Act Title VI Native American programs, Alaskan Native programs, as well as Native Hawaiian programs. A little bit about the Elder Care Locator at this time. It was established in 1991 and is our nation's only national information and referral resource that provides support to consumers across the spectrum of services and issues affecting and impacting older Americans. I want to make sure that everyone has our toll-free number, which is 1-800-677-1116. And our website is eldercare.acl.gov. Through our National Call Center, which is open Monday through Friday from 9 a.m. to 8 p.m. Eastern Standard Time, older adults and caregivers are connected to local programs and services. They speak with a specialist, and actually, I should say a specialist who is certified, and that specialist is knowledgeable information and referral specialist who will provide accurate, unbiased information on a wide variety of issues impacting older Americans. This could include information on transportation, in-home services, and information and referral to such critical conversations that we have, such as where to report suspected elder abuse. In fact, last year, our statistics showed that over 6,000 calls came into our call center regarding suspected elder abuse. Our call volume is great. In fact, we receive over 1,200 calls a day on average. We listen and directly transfer to the appropriate local programs and services. This includes one's local area agency on aging, who are the local experts of the community services offered and who provide a variety of in-home and community-based services. As I mentioned, people can also visit our website, eldercare.acl.gov, to learn more and to connect to local services and programs. We offer a wide variety of educational materials and brochures that are available for distribution as well. A large number of our callers are referred to us by federal agencies, including Medicare. For individuals with Medicare insurance-related questions, we often refer individuals to their state health insurance counseling program known as SHIP. SHIPs are a great resource. The state health insurance counseling programs provide local, in-depth, and objective insurance counseling and assistance to Medicare-eligible individuals, their families, and caregivers. Questions that they often get would include considering making coverage changes during the annual election period open enrollment, individuals who may be worried about out-of-pocket costs associated with Medicare, individuals who are unsure about their Medicare eligibility and the criteria and guidelines. They may wonder about what Medicare covers or what it doesn't cover. In fact, we actually get quite a few calls from individuals unaware that that Medicare does not cover long-term supports and services in many cases. We get a lot of calls from caregivers confused about that, and the SHIPs are a great resource to really understand what is covered. They also may be confused about who pays first, Medicare or another insurance program, or they may even be unaware of what their rights are under Medicare. So for individuals, again, who are with those types of questions, we may refer them to their local health insurance counseling program. The local numbers are actually available also on our website, again, eldercare.acl.gov. Another way to find one's local SHIP program is through a toll-free number, and I'll provide that number as well, 1-877-839-2675. Again, I encourage everyone to visit the eldercare.acl website to learn more, or to give us a call, and we'll be glad to talk to you about the services and programs and make those appropriate referrals to those agencies in your area. You can also chat with us if you go online, or again, just simply give us a call, and that number again is 1-800-677-1116. Thank you so much for allowing me to talk a little bit about the Elder Care Locator and the SHIP programs.
Thank you so much, Patrice. We really appreciate it. Again, I want to remind everyone on the call that you can ask a question by pressing *3 so that we can at least get you in the line so that you're ensured that we will answer your question today. I know that some people are watching on Facebook. You can also submit your questions on Facebook. I know we've already received one about how to figure out prescription drug plans and how to find the right one for you. So stay tuned because we will make sure to answer that question. But don't lose your opportunity to ask your question, your burning question. Don't be shy. Press *3. We would love to hear from you. At this point, we would love to introduce you to Erin Fisher from the National Association of Health Underwriters, who's going to talk to you a little bit about using a health agent. Erin, are you there?
Yes. Hello, everyone. I'm Erin Fisher. I am a member of the National Association of Health Underwriters, and we actually aren't underwriters. We are all agents and or brokers. Many of us deal in all aspects of healthcare, but many of our members also are experts in individual areas of healthcare, including Medicare. Anybody can go on the website and find somebody in their zip code or in their state that is an expert in Medicare. I'll just give you the name of the site right now. It's www.n as in national, ahu.org. And there is a box that says find an agent. And there's also actually a Medicare section. So what agents in our association do, which by the way, we represent over 100,000, the Medicare people take annual exams with the carriers, annual. This year, just to give you an idea of what that's like, I took 40 hours of exams and testing to sell the carriers that I represent in the area that I sell in. So the exams are quite stringent. An agent also has to be licensed in the state that they do business in, and they have to be appointed by the carrier. They go through a background check, then they're given the okay to take the exam, and they have to pass the exam with no more than 3 questions being wrong. So I'm emphasizing this because we are very serious about our jobs. We wouldn't be going through all this if we weren't compassionate about what we do and how we serve people in the Medicare community. Many agents sell more than one plan, which is a really good suggestion. If you're talking to someone, you want them to represent a couple different plans because you would have more options at that point. Many agents sell not only the Advantage plans, but also the PDP plans so that you can decide which way that you would like to go. Because the Medicare Advantage plans have enhanced their benefits for next year, there are many more plans in areas of the country. So it's well worth taking a look at them to see if they would be a plan that you would be interested in. The Medicare Advantage National Committee, which I am on, is an invited committee. We do a lot of work with Congress. We also try to do, as Allison said, talk to regulators, talk to our congressmen. We bring, I personally bring my clients to talk to our congressmen about how they like or dislike Medicare and what's going on with them. Congressmen definitely want to hear from us. They know that the Medicare age people, of which I'm one, that we vote, and they do want to hear what's going on in our lives, whether it's Medicare or something else. These agents with the National Association of Health Underwriter also act as your customer service people. So if you're having a problem and you don't want to call customer service, you can call them. They'll get the answer for you. They'll solve your problem if they can. There are many things that we're restrained from doing because of the HIPAA regulations, but we definitely help all the people that are our clients. The agents are also kept up to date, not only through their annual exams that they have to take, but NAHU itself has meetings for Medicare agents where they're giving a lot of background education on Medicare, all the regulations that go into it, eligibility questions, because there are a lot of them. Many people make a mistake on when they do enroll in Medicare. So these agents are trained to help in all aspects of Medicare. So just to say it again, if anybody is interested in having an agent, they come to your house or they talk to you on the phone, whatever you would like, you can go to the National Association of Health Underwriters website, nahu.org, and you can find one right in your own zip code. So thank you very much.
All right. Thank you so much, Erin. We really appreciate your expertise and your insights. At this time, I would like to at least announce the results of the second poll question, which was, what do you consider when you're shopping for a Medicare Advantage plan? And well, we have a fight here because we have a different answer from our folks on the phone and a different answer from our folks on Facebook. 40% of you on the phone said choice of plans versus 30% that said enhanced benefits, whereas and 20% said provider networks, 10% said lower premiums. I guess that means you already have great premiums or affordable premiums with your current Medicare Advantage plan. Whereas on Facebook, the majority of you said that you consider enhanced benefits most, and I guess choice of plans second when it comes to choosing a Medicare Advantage plan. And at this time, I would like to go to the third poll question, which is, well, actually, before we get to the third poll question, I would like to talk about being an advocate. Apologize for that. So the Congresswoman talked about the importance of supporting Medicare Advantage and of using your voice. And Erin also echoed those sentiments about contacting your member of Congress about Medicare and Medicare Advantage. And obviously, through BMA, we like to help assist you to use your voice, particularly in regards to being an advocate for Medicare Advantage. So below are immediate ways of which you can get involved with Better Medicare Alliance to advocate for a strong and secure Medicare Advantage on your behalf. And that is, one is to sign up. Sign up to be a BMA advocate at MedicareMyWay.com to receive updates, our alerts, e-newsletters, as well as to answer surveys. Similar to how we're asking a lot of polls today, we like to collect this information and share this with members of Congress. They want to know, what are older adults considering when they're entering into Medicare or when they're navigating through Medicare? How are your experiences changing from year to year, and do your considerations change year to year as you get older? We also like to invite you to join our BMA Ambassadors group. They're a fun group of older adults who talk to one another, share information on Facebook in a private group, but also they are our most active. They're our most active advocates. They're our champions. Love them very much, but they volunteer to work directly with BMA staff to participate in advocacy activities. You can do this from the comfort of your home online, or you could sign up to do more. But primarily it is signing these petitions and sharing letters, writing letters as well to your member of Congress about your issues and your story. If you would like to become a BMA ambassador, please email us at community@bettermedicarealliance.org. Again, that is community@bettermedicarealliance.org, and request to join our private Facebook group. Why you should become a BMA ambassador? Well, again, they're our most active advocates, most engaged. They do tend to win prizes and things like that. This is completely voluntary, of course, and free to participate. And you get to participate in a monthly conference call in which we share with you what is happening here in Washington, what changes are being made to Medicare. We keep you informed so you can be the smartest person in your family about Medicare. But we also help you contact your member of Congress. We give you information to share in your community about Medicare Advantage. We'd like to invite you to host events, a coffee chat, a workshop, a fitness class in your community. We also love to invite you to organize trips to Washington. We assist with that, usually in regards to specific issues or concerns. But more importantly, for everyone, if being ambassador sounds like too much, we invite you to join one of our senior task force. And this is where, again, you can be an advocate for yourself, your peers, your friends, your family. Participation is free and completely voluntary. We ask for approximately 1 to 2 hours of your time each month. And as I'm saying all this, I'm still inviting you all to press *3 in order to ask your questions in regards to Medicare Open Enrollment. This is the time, or to write your questions in the Facebook chat group. But our task forces include our Keep Prescription Drugs Affordable Task Force, which is comprised of older adults who are affected by rising drug prices and gives them a collective voice to advocate for stable and affordable prices for their medications. Our Medicare My Way Task Force, which is a group of our most dedicated advocates who have chosen to work directly with BMA to advise the Medicare agency, Centers for Medicare and Medicaid Services, on Medicare they want and need. The immediate focus of this task force will be to point out the value of supplemental benefits, enhanced benefits, such as routine eye checkups, hearing or dental care, transportation, silver sneakers, and the like. Our Medicare Advantage Retiree Task Force is a group of supporters who advocate for millions of seniors in the U.S. who are enrolled in Medicare Advantage health plans sponsored by a former employer. And then our Chronic Disease Task Force is comprised of older adults and caregivers who either have chronic diseases or support loved ones that do. And at this time, I would like to get to poll question number 3, and which is, which BMA advocacy activity would you be interested in participating? Press 1 for sending a letter to your editor or a member of Congress. Press 2 for completing a BMA survey. Press 3 for signing a BMA petition. Or press 4 for joining a BMA advocacy task force. Again, the options are press 1 for sending a letter to an editor or a member of Congress. Press 2 for completing a BMA survey. Press 3 for signing a BMA petition. Or press 4 for joining a volunteer BMA advocacy task force. Okay. So while you are completing this poll, at this time, we would like to start answering some questions. So far, we have a lot of shy people, it seems, because we have, let's see, about 100 people on the line, and no one wants to ask a question. If you're having any difficulty getting into the queue, we also ask you to either go to our Facebook group at facebook.com/Better Medicare Alliance. And you can see our live chat happening right now. You can see us here in Washington and submit your question that way. Or you can try calling us at our Washington line, 202-735-0037. Again, that's 202-735-0037. In the meantime, I'm going to ask one question that we received, which is, Debbie asked us, what changes can you make to your Medicare during the open enrollment period? I'm actually going to kick that over to Patrice from N4A to see how she would like to answer that question. Patrice, are you there?
I am here, and what I would suggest is that, again, you may want to call the local health insurance counseling program, your SHIP program. That number is 1-877-839-2675, and you can be connected with your local SHIP program in the state that you're in.
But just to answer it, I think I'm happy to just chime in a little bit. Generally speaking, what you can do during open enrollment is that you can change from traditional or original Medicare to a Medicare Advantage plan. You can change from a Medicare Advantage plan back to traditional or original Medicare. You can switch from one Medicare Advantage plan to another Medicare Advantage plan. Or you can switch from a Medicare Advantage plan that does not offer Part D coverage, drug coverage, prescription drug coverage, to a Medicare Advantage plan that does offer prescription drug coverage. They're called MAPD plans. And last, you can switch from an MA plan with drug coverage to one that doesn't have it. And finally, you don't have to do anything if you like your coverage that you have, which is a good thing to know. So everyone thinks, okay, do I have to go and do something? If you're happy with the coverage that you have, you can stay with it. If you want to explore other options, which is kind of what we're suggesting here. At Better Medicare Alliance, we feel pretty strongly that Medicare beneficiaries should be active choosers, is what we say, is to understand your options and to make a choice that works for you. And to understand that you can make that choice again every year, which is pretty great. And this year, you do even have this additional period of time in January to change your mind. So people say, oh my goodness, if I make a decision, what if I want to make a different decision? The fact is, this year you can make a change in January, between January and the end of March. And of course, if you find that the plan isn't quite right for you, you can change again next year. But there are a lot of choices. That Medicare and new handbook is kind of daunting. I get one, I'm over 65, and I look at it and think, really, am I going to look through all of this? But the fact is that it's gotten better. It's an easier explanation about your options and choosing between original Medicare and Medicare Advantage plans, and then what that means for you. So we encourage you also to actually reach out to an agent or a broker in your community, or to go to a SHIP counselor. And if you have difficulty with any of these things, bring along a friend, bring along a caregiver, have them help you with it. You can go online to look at Plan Finder. That takes a little while to get through that, but maybe somebody can be help you with that as well. You can look at it one day, decide the next day, whatever works for you. But you do have this period of time between now and the beginning of December to make those kind of choices, and we encourage you to do it. We have any questions?
Yes, and actually, I was gonna say, I don't know if Erin wants to jump in about this extra enrollment period for Medicare Advantage, what your thoughts are with that, or what special considerations you would advise? Okay.
So there is going to be confusion with the words open enrollment because of the new one that is being started January 1st to March 31st. So the first one from October 15th to December 7th is actually called the annual enrollment period. So that's when you can make all the changes you want and as many changes as you want. From January 1st to March 31st, that is called the open enrollment period. So during that time frame, you can only make one change to the changes that Allison mentioned. So there is a distinction between the two periods and what you can do, but unfortunately the names are very similar and can be confusing. But it's good that we do have a lot of time to make up our mind to change plans if we want to. Thank you.
Thanks, Erin. And also, you will notice, or you should have received by now, the new 2019 Medicare and You handbook. We really advise you to look through it, find it in your mailbox. Don't throw it away. Don't use it to, paper your bird cage. Really look at the handbook because the administration has really worked hard to make changes to the handbook to make it easier for you to read and understand, to provide even more information for you, particularly on Medicare Advantage. They've done a better job of clearing up some of the information, and we really advise you to utilize that. Also, there's a new plan finder. There will be a new Medicare plan finder rolling out next week. There's also a new tool called the Medicare Coverage Wizard, which is extremely important. It helps you ask yourself some of the questions that are critical to making those decisions. What are your health needs? What are your financial circumstances? And gives you some suggestions with each, with how you answer those questions. So we really advise you to do the Googles, and find the Medicare Coverage Wizard and look at the Medicare Plan Finder to help with some of these decision making, which is what I'm going to be the answer for this next question that someone submitted. And then lastly, what we're anticipating is a new handbook of sorts that's focused just on Medicare Advantage. So the administration says that they're working on one. We haven't seen it yet. We'll review it when it comes out and let you know if it's, useful, good, all the information you need, missing information. Some of our top questions that we tend to get from a lot of our senior advocates is about how do they get extra help with chronic diseases. And we really invite you to look at the plan finder, for special needs plans. So if you have specific chronic conditions in certain counties, you could be eligible to enroll in a special needs plan under with a Medicare Advantage carrier that can provide you extra assistance with disease management and really help develop a real plan to manage your health care to keep your costs down. So that's pretty important. So at this point, that kind of segues right into this next question that was submitted on Facebook, which is which plan helps them, and again, we're inviting you to press *3 to submit your questions on, if you're on the phone. Which plan helps the most with prescriptions? I'm on 3 diabetic medications and losing over $500 a month. Well, that's obviously not great. That's not good at all. And so what you should have gleaned now from this call is that there are now additional opportunities to switch, to make decisions, to review what your options are and see if there are more affordable options in your area. You want to be able to really, the plan finder has been changed and revised to really be able to put in all your drug formularies, all the ones that you need, that you know you need from your provider, and it's supposed to spit out the most affordable, all your options, including the not so affordable. But you should be able to see more than one option, right? And go through it to make the best option for you. Congressman, did you want to add anything?
Well, if whether Patrice or Aaron want to add to that, they may want to, because this is, again, it's a very individual choice. You have to look at the plans and what you think works best for you. And when it comes to prescription drugs, you can look at standalone Part D, or you can look at an MAPD plan. And they all have formularies, which means that there's a list of drugs you can take, and you need to have one that matches up with the ones that you've been recommended by your clinician. So in some ways it makes it easier because you know exactly what you want or what might be a clinical equivalent. So you can go online and find that out, or you can talk to one of the SHIP counselors. Patrice or Aaron, do you have anything to add?
I do. So if the person is on a Medicare Advantage or PDP plan now, I suggest every year that people call their plan to see what they're during open enrollment, during this annual enrollment period, to see how their prescriptions are going to be covered in the following year, because they could be different. They could move those, especially the diabetic drugs, but any drug, they could move it to a different tier where it's either going to be less or more expensive. So you want to find that out while you have the opportunity to change your plan. Also, as far as diabetics go, the Diabetic Association could help you find a nonprofit organization that would help you pay for your drugs. Mm-hmm. There's also a nonprofit called Needy Meds, and they're almost, you can think of them as a clearinghouse. Depending upon your income, they can find nonprofit organizations that can help you pay for your prescriptions. Most of them do depend upon your income, but some do not. So that, and any disease that anybody has, they could call that national association and learn how they could get help with their prescription.
Great.
Wonderful.
Good comments.
Okay, so again, imploring you all to, if you're on the phone, press star, that's the symbol that looks like an asterisk, *3 on your phone to ask your question. It seems like our online participants are a lot more chatty today. So we have another question here from Facebook. I am currently enrolled in Medicare Part A because my spouse has insurance through their job. However, my spouse may be seeking a new job next year. What are my options if this happens? Patrice or Aaron, did any of you want to take that one before we give it a whirl?
Aaron, I'll let you handle that one.
Okay, so could you just read the question again?
Sure,
please?
Absolutely.
Employer coverage now.
Yeah. So this is someone who is getting Medicare Part 3 because their spouse, they're enrolled in Medicare Part A. Sorry.
Yeah.
Part A, not 3. I've been saying 3 a lot to you all today. Okay, is currently enrolled in Medicare Part A because their spouse has insurance through their job.
So they're not paying Part B yet.
Right. So they're not paying Part B yet. However, my spouse may be seeking a new job next year. What are my options if this happens?
Well, if the new spouse gets a job, then she would be able to get her health care under his, I'm assuming, although there are some companies that aren't covering spouses now. She could also, even now, she could look into how much does it cost under his current plan or under a future plan compared to how much it would cost her to go under Part B of Medicare and another Medicare plan. Mm-hmm. So it's not necessarily going to be about the benefits, because Medicare usually has many more benefits than a group plan. So it would be about the money. How much does it cost under the current plan versus comparing it to how much it would cost under Medicare and a Medicare Advantage, Part D, or supplement plan.
I will make one other comment, but it is important to not let your insurance drop, your Part B. So if your, I think it was your wife gets a new job, just make sure there's continuity of coverage. So either she's able to keep her current coverage under her employer and then seamlessly get enrolled really quickly. But there's a point at which there's a penalty. Some of us are working to get rid of this penalty, but a penalty for not having any coverage. So if you think there's going to be a period of time when there isn't employer coverage, you should sign up for Part B and pay that Part B premium, because otherwise there's a penalty for future payments under Part B. So again, Erin's right, compare your options, whether it's smarter for you to actually think about paying Part B, which you have to pay first, and then looking at whether you want to stay and when you want original Medicare, maybe buy a Medigap policy as a supplement, then pay Part D as another supplement. Maybe if you get dental coverage now or not, pay a supplement or vision care, or whether you want to look at a Medicare Advantage plan that typically combines most of these benefits in one premium. But as long as you're covered through your employer and it's seamless, you're actually don't have to do anything else about Medicare. But once that drops, once you stop having employer coverage yourself or through a spouse, you have to sign up for Part B.
And I'll just add that there's a lot of conversation happening in Washington right now about the Part B penalty and how that could be modified in order to not affect so many people. And we at BMA are tracking that conversation. And so, this is, again, one of the reasons why you should use your voice if this is something that a lot of you are experiencing, as many of you are either working longer or have a spouse that's working longer, that is a trend. It is definitely a conversation you should be paying attention to. So we invite you to go to MedicareMyWay.com and sign up to get updates in this manner so that you can stay up to date and make the right, be prepared to use your voice and then make the right decisions for yourself and your family.
I believe it's called the Benny's Act, actually, and we
Yes.
support it. So it is legislation out there that says that they should do something to soften the penalty, because it's a rather strong penalty that you have to pay for the rest of your life under Medicare. And a lot of people don't know that, particularly as more of us who are over 65 are continuing to work or our spouses are. So, and people don't know what to do. So it was a really good question. Thank you.
Yes. And also a great segue to at least the results of our last poll of the day, as we are entering 5 minutes left. So this is your last chance also to ask a question.
You can always email us.
You can always do that, but press *3 if you're on the phone, if you want to be the last question of the day, or submit your question online in the Facebook group. But here are the poll results of poll question 3, which was when you sign up as a BMA, the advocate, notice I said when, which activities are you most interested in? And again, I don't know, the online folks and the phone people are fighting today, but on the phone, 40% of you said you would like to fill out a BMA survey, which is very exciting for us. We love information. And then 40% of you also said that you would like to sign a petition in support of Medicare Advantage, and that's excellent too. 20% of you said you would be interested in joining the task force. And 0 said sending a letter. I guess people think people don't read letters anymore. They do. It's still effective. But online, our Facebook respondents said that they would be most interested in volunteering to join one of our task forces, which is excellent news for us. Please again visit our website at MedicareMyWay.com to learn more about those task forces and get signed up so that you get all the alerts. So at this time, we only have 3 minutes left. I think unless there are were there any additional remarks, Patrice or Erin, that you would like to share before we kick it to the Congresswoman?
This is Patrice. Patrice.
This is Aaron. Oh, go ahead, Patrice.
Sorry.
Okay. I just wanted to add a little bit more information regarding, I know we had a comment from someone who was referring to their diabetes, and I just want to make sure that our audience is aware of local programs and services, many of those provided through the area agencies on aging, like chronic disease self-management programs that can be very important and can really help, with those that have chronic disease situations to help them self-manage their programs. So again, they can contact their local area agencies on aging to learn more about a wide variety of different services and programs, and you can do that through the Elder Care Locator. We'll be glad to connect to those local programs and services.
Erin?
All right, this is Erin. I just wanted to add on to the last question. If a person is on Part A, they don't need to go on Part B of Medicare unless they're under 20 employees in the company. And even with that, really need to talk to an agent about how that would work. But if they're over 50 employees, a person does not have to go on Medicare. They can if they want to, if it's financially beneficial to them. Also, I want to mention to her that since she's on Part A of Medicare, if something happens where she would be offered COBRA, because let's say a person gets laid off from their job, she would have to go on Part B of Medicare and go on a Medicare plan, which actually would be a lot less expensive than COBRA and have more benefits too. So I just want to make that a little clearer to her.
That's great.
Thank you.
Well, you can see that these questions are complicated, and it is harder to and more complicated than we all thought when we turned 65. That would be just easy when we just had healthcare and there's no decisions to make. But again, we at BMA encourage you to make decisions for yourself that work for you, to look at them every year to see if that plan is the right one for you, and also to join Better Medicare Alliance. We're just delighted to hear your questions. Sometimes it does really inform us in terms of where we should stand on issues. What are the concerns that you have? What's working for you? What's not under Medicare? And we would be delighted to have you go to Medicare My Way, learn more about us, ask us questions, go and see the kind of work we're doing here in Washington. Because again, the election's coming up. I was a member of Congress for 10 years. I got to tell you, we paid attention, and we should, to all of our constituents. But certainly the issue of Medicare is one that's just enormously important to not only those of us who are over 65, but to all of our families as well. So we look forward to working with you in the future. Thank you for taking your time to hear more about open enrollment and to be a really informed, active chooser of your health care coverage. Thanks so much.
All right. Well, this concludes the 2018 BMA Medicare Open Enrollment Tele-Town Hall. Make sure that you don't miss the next one next year around this time. Also, this was a lot of information. We will be sending you the open enrollment guide. So check your inboxes. We have your email address, but if you don't think we have your email address, share it. Send it to us at community@bettermedicarealliance.org. We promise you we do not resell your information to any companies. We simply just use it to provide you information about what Better Medicare Alliance is doing, and to alert you on updates. So, again,
Good luck.
visit us at MedicareMyWay.com. That is a website just for you all, and thank you so much for joining us today.
Thank you.
Thank you.
Oh, and thank you, speakers.
The Access Live event has ended.